Thank you, Mr. Chairman, Ranking Member, for holding this hearing, another important one. You know, it just seems like to me this is another example of how middle-class families are getting squeezed. It's hard enough for any family to put aside anything for savings today, given the squeeze on families. And now we expect families to save for retirement and for long-term care at the same time that many are absorbing the costs of caring for an elderly family member. So we've just doubled up here. There's a growing conversation about the retirement crisis in America, and in the face of this, the lack of a basic safety net on long-term care is just more fuel to the fire on the kind of problems we're going to face. And as you've made clear, retiring baby boomers are ill-equipped to cover the full costs of their long-term care needs. You know, we've got fewer people, they've got lower savings as they hit retirement than their parents did. Only 18% have retired benefit plans. A third of all seniors have less, or as they approach their senior years, have less than a year's worth of income, and a third have no savings at all. So that leaves us with Medicaid as sort of the backup program here, which can cover some of the costs. But the current system forces seniors to spend most of their assets in order to qualify. Every bit helps, but to qualify when they've got to sell off all their assets, this has other economic implications. So where I wanted to start is to ask you, Dr. Fetter, can you tell us a little about the financial instability that selling off assets causes our seniors?
Thank you, Senator Warren. I think when people talk about seniors relying on savings, I think that they are to finance long-term care. I think they are insensitive to the variety of risks that come with getting older. There is the risk of a concern about having adequate resources to cover your needs. You don't know how long you're going to live, so you've got to plan for that. There are ups and downs in what happens to your assets, as we've seen painfully with our recent economy, what's happened to resources in that period. There's the ability to assist your children in taking on their new lives and enabling them to do what parents did for grandparents did for the now parents, dealing with the fact that we've got many young people, even those with an education, not able to get jobs, and so needing more assistance from parents as they age. And I am a grandmother, and looking forward to supporting my grandchildren and encouraging them in their education and building their independent lives. And there is uncertainty all the way around. When people talk about relying on your assets in order to take care of those needs, what you're saying is that that's one lump, and when you use them, they're gone. So you have so many risks, including, I didn't even mention the healthcare risks and the uncovered healthcare costs that seniors face. So you're using your assets, that's what you've got, to protect you against a whole array of risks. And a catastrophic risk, like a serious need for intensive long-term care, is just beyond the capacity of this nest egg, little or moderate, or in some cases larger, to take care of. And that's why it's so important that we need some kind of insurance mechanism to which people can contribute in order to give everybody security.
So let me just build on that and frame the question a little bit differently and ask, if I can, Ms. Tumlinson, if you can explain why Medicaid is not a very good substitute for a pre-designed, well-functioning long-term care system. If you could just kind of summarize that for us.
Sure. Okay. I'll be thoughtful in this response. So I think the primary, when you think about what Medicaid was really designed to do, it's not designed to protect individuals against risk. It's really designed to be there when everything else has failed, which is really the opposite of insurance. Was that succinct enough?
Yes, no, but go ahead.
Yeah, okay.
I'm going to point out, because it's a very good point.
Right.
And I think it's critical to understanding. A lot of people think, well, we've got Medicaid, so I'll be okay if there's a problem out there. And maybe another way to say it is to ask, is this a sustainable path? That is, counting on Medicaid to be the safety net, and at best, only modest savings that people are putting aside during their working years.
And I think when I think about it also from the perspective of what I see people doing in the marketplace right now, which is essentially using their savings to purchase something that will keep them from being on the Medicaid program eventually. In other words, it's not, in theory, what you would want an insurance product to do is to enable you to purchase the services that you need in the setting that is actually most appropriate for your needs. Whereas a safety net program is really, again, kind of designed simply to absorb sort of in the most, custodial and warehousing situation that bare bones funded. It's really, again, kind of the opposite of what you would expect an insurance product, a good insurance product to do. And when my own parents, when I encouraged them to buy insurance, it was really, my dad said, well, my federal pension will cover the cost of a nursing home. And I said, well, but wouldn't you like to stay at home? And, let's insure against being in a nursing home.
That's a nice point. Mr. Chairman, could I ask Dr. Chernof also to respond? Dr. Chernof?
There we go. Thank you. Yes, I agree. I mean, I think that, we have public policy that's, I've said this before, I'll say it in front of all of you, we have public policy that's sort of perfectly built for 1972. And the reality is that, Medicaid as a program in its inception was predominantly focused on women of childbearing age and their children. I mean, that was really its kind of constitutional core way back when. And the average life expectancy in 1965 was 69. And, as a physician, if I was in practice then, you would have just seen the first ICUs and CCUs. The likelihood of surviving, a fairly morbid or mortal event like a serious stroke or heart attack, we're a very different time and place. People are living much longer and will live with more serious chronic illness and functional limitations. The reality is our public policy hasn't kept up with that. And the reality is that, Medicaid, I agree with Ann's sort of description of the role of Medicaid, and I would just offer to all of you that the null hypothesis, if we do nothing, is incredibly expensive, and that Medicaid will bear the burden of that, and it will bear we will all bear the burden. Families will bear the burden, states bear the burden, federal government bears the burden, in kind of an unstructured way. So I think, as you think about the work of the Commission, while we didn't make a specific financing recommendation, and we're having kind of a broad discussion here about the ranges of ways that one might consider solving it, every single commissioner thinks that there needs to be a solve. And I think this notion of a different model, and one that actually confronts the long-term care need this country faces as a way of taking pressure off some of the public programs. And what would it really take? What would it really take to design a program that fundamentally actually shores up certainly Medicaid, but also Medicare to a degree? Because I will just say as a doctor, my last point, and then I'll stop, I promise, the nightlight in this system is the emergency room. Yeah. So I get the point that Medicare doesn't pay for long-term care, but at the end of the day, when something happens in somebody's family and you throw up your hands, it's a trip to the emergency room. And I will tell you that the emergency room doctor takes one look at that person and says, upstairs we go, and the process begins. So I think what we're having together, us and all of you, is this sort of fundamental discussion about the need to think about a different structure to take on this issue in the process of shoring up our public programs.
Yeah, well, I thank you. The questions addressed earlier to Ms. Tumlinson about how we're going to pay for this, you give us all the reminder. If we don't design a program, we're still going to pay for it. We're just going to pay for it in some really terrible ways. So thank you. Thank you, Mr. Chairman.